Today, we're going to delve into a landmark ruling that was buried in the media due to the destruction of Hurricane Helene and the raging war in the Middle East. On September 25th, Judge Edward Chen of the U.S. District Court of Northern California delivered a powerful verdict against the Environmental Protection Agency, EPA, regarding the safety of water fluoridation. This ruling marks the culmination of a 7-year legal battle and underscores a pressing public health concern: the potential link between fluoride exposure and reduced IQ in children. Judge Chen's 80-page decision highlights an unreasonable risk posed by the current fluoride levels recommended by the CDC and the American Dental Association, revealing serious implications for educational attainment and future productivity. This raises critical questions about how we regulate substances that directly impact our children's health. Sound familiar, anyone? Like recently pushing experimental technology and biologic agents on our children with no safety studies, right? No long-term safety studies. Well, despite the EPA acknowledging evidence of fluoride's neurotoxicity, they claimed they could not complete a risk assessment, citing uncertainty. Critics argue this reflects a troubling failure to act in the face of clear evidence. With the ruling mandating that the EPA take action, we are left asking, what does this mean for water fluoridation policies across the country? And how will the public respond? Kind of poorly if the public doesn't even know that this existed. As media coverage of this verdict has been mixed, many are left confused about the implications of this decision. Is this the final victory for public health advocates, or is it a scandal that remains largely unaddressed? You may be asking, how long have we been adding fluoride to the water? Well, that began in the late 1940s. The first city was Grand Rapids in 1945, and then the practice spread wildly. We're going to address this, and we are also going to address Health and Human Services propaganda on their social media. And joining me today is probably my two favorite people to join me in discussing this is Tim James, owner of Chemical Free Body, and Nurse Ashley Grogg, who is also a co-host on Nurses Gone Wild. I mean, Nurses Out Loud.
Cat's out of the bag.
Exactly, cat's out of the bag.
Oh, that's so funny.
Thanks
for having me, Jodi. Appreciate it.
There we go. You just ruined my awesome opening. Now I forgot what I was going to say. No, seriously. I mean, come on. Like, what is up with this, guys? I'm so over these agencies.
Go ahead, Ashley.
Well, same stuff, different day. It's kind of the way I look at it. It's really ridiculous to see that all of this has happened. I can't wait to dig into this topic because I have been following this. I should have been following it a lot longer, but for the past several months, I've been watching this case very closely because this really stands to make big changes. But the big changes aren't going to come from the three-letter agencies, right? They're going to come from the people. It's up to us to decide. The court of public opinion is where I put my money because people make change. Apathetic people don't make change. But when people start to realize the impact that this has on our society, I think that they're really going to start taking action and hopefully changing things at the local level. What about you, Tim?
Well, for me, I just want to take a a common sense approach to it. And I wonder how humans and every other creature on this planet lived without fluoride in the water before the 1940s.
Hmm.
They must have been at very high risk because if you go back and start looking again, people show pictures of people on the beaches in the 50s and stuff like that. They were in 40s and 20s. I mean, you go back to the 20s, there really wasn't any overweight people. Everybody was pretty healthy,
Hmm.
right? And wild creatures are pretty healthy. So and then you look at a lot of the fluoride actually comes as a byproduct from the aluminum industries and other chemical industries and stuff like that. And I think even that article that you sent me, Jodi, that you're talking about, it was something like they were getting it out of the smokestacks of chemical plants or something. I'm just like, how does that even fit into the diet? How, what possible, how can we as a public even think that that's okay just because here's the problem is that there's a hierarchy that needs to be in place as people go through life, and it should be God at the top, and that could be whatever that is for you, your creator, and then you, and then the system. And when you look up to a system to dictate you what goes in your body and what you need to do and how you do things and in your family's body, your children's body, that's your hierarchy's out of order. The system's below you. In fact, the system works for you. That's where your taxes go, which we shouldn't even be paying taxes. I mean, Thomas Jefferson said that even a 1% tax is a form of slavery. And so, I mean, I'm paying a lot more than 1%. I don't know about you guys, right? So anyway, that's it. I just take a common sense approach. The earth doesn't create it, doesn't put it in the water, at these amounts at all, not even close. And there's tons of studies, and people that are arguing that, oh, there's science, there's no science, or if the EPA says, hey, they're just gonna like keep batting the ball around and say there's no science on it. Or if they do have science, it's people call junk science. Science is supposed to be on what's called the scientific method. So you can do something where it's repeatable, like the law of gravity. You test, and that's true science. You're trying to find out what's really happening in the real world. This isn't scientific consensus just because a bunch of people say it is because they want to get funding because that's where the money goes. And then the other thing is checkbook science, where it's just another side of that coin, which is, we're going to pay you enough money to come up with a way to come up with this result. And I've talked to a lot of doctors. I've met a whole bunch of doctors and people that know how to read. Um, clinical trials and stuff like that. And, when you think about a doctor, how busy they are, they don't even have like 15 minutes with their patients barely, right?
Right.
So when they're reading an article, they read the abstract or the summary, right? And they're going off of that. They don't read the 136 pages. But on page 132 is where it doesn't match up with the summary and the abstract.
Hmm.
But you're not going to know that until you read the whole thing and you know how to put two and two together. So I've had many doctors tell me that most of their colleagues don't even know how to read articles properly, and they're not reading the entirety of the article to get the true story. They read it and they go on. A perfect example, I had Dr. Farrell Torkel on my show. He read an article clinically published that 2 drinks of wine is good for you, or 2 drinks of beer, or 2 alcoholic beverages before bed helps to calm the nervous system and help you with stress so you have good sleep. And that's what he did for years because it was in the literature. He's a medical doctor. That's what he did. And until he got into wearables, you guys familiar with, like the Oura Ring and the Whoop band and the Garmin watches and stuff like that, where they can track your body and your steps. Well, they
Oh,
also
yeah.
track your sleep. And so he put on one of these wearables and he was like, tracking his sleep, and he's trying to get his sleep numbers up. And he's like, oh, I'm going to have a couple glasses of wine or something. And he did that. And then he woke up and his sleep went from like in the 90s. It's a 0 is poor, 100 is the best sleep. And he started, I think, in the 80s, worked his way up to 90s. Then he had a couple glasses of wine. He wakes up the next morning, his sleep tanked down into the 60s. And then all of a sudden, reality set in where he's like, wait a minute, the reality of what I just experienced is not what was in that article, in that clinically published article. So when people say science, now the question is, which one are you talking about? Which one are you talking about? So I don't claim to be a scientist or anything like that. I'm an Eastern Oregon redneck, and I I believe in common sense and I believe in Mother Nature. So that's my standpoint.
You know what I think is crazy is you talk about checkbook science. When you research into this, you see that the EPA is saying that they can't do the study to find out at what point causes harm because there are too many variables. So we go back to the idea of the COVID vaccines or the jabs or whatever the heck you want to call them. They didn't know. And here's another case where something is being forced upon Americans. They don't get an option anywhere you're drinking public municipality water. It's having fluoride added to it. And they cannot tell you at what point it is going to cause you harm. So somebody who's trying to be healthy drinks more water, gets a larger dose. I don't know who wants to be healthy. Maybe pregnant women, those women with babies growing in their womb, their brains are developing, the ones that are, extremely subject to neurotoxicity, and they're drinking more water because they're trying to be healthy. What's that doing to our babies?
Well,
We
I was
don't know.
actually reading an article on this before about from Natural News from like 2014. And it said in 1988, Chemical and Engineering News ran an article that detailed the suppression of evidence that fluoride is actually a highly poisonous substance. The report cautioned that the ingestion of fluoride, especially by children, which you were pointing out, Ashley, was as poisonous as lead and only slightly less harmful than arsenic. It charges that the United States Health Service has known since the 1950s that the levels of fluoride are cumulative, building up over the years that a person ingests it. So it's not just about taking it now, it's like in your lifetime, it's going to build up and you might not notice it right out of the gate, but eventually, you will. And all of a sudden you'll have this disease and then you go into a broken medical system and they'll give you more chemicals to treat your chemical deal.
Right. And see, and that's the whole problem. It's the same with the injections, right? The immunization schedule.
Hmm.
They don't know the cumulative dose effects of these because they're not studying that. But what we do see is a higher incidence of autism, diabetes, obesity, people not knowing if they're a man or woman, gender dysphoria, right? A whole allergic to peanuts, asthma. I mean, I could go on, right? And people, we see like, oh, how far we've come in science and medicine. And you see how much sicker we are. So when you look at it and thinking critically, I mean, because that's what we have to do is think critically. Like you said, Tim, you said, you look at pictures of people back in the 40s, 50s, 60s, and they are all normal weight. They're normal weight. And now we're
Yeah.
not. And now we're suffering. And now we have created this population, of people either, maybe big pharma users. I mean, it's nothing for a 30-something-year-old to come in to the ED and we triage them and them be on medicine for high blood pressure or diabetes. And you're like, what? If you were to ever see these, it would be in somebody who's 70, 80 years old, maybe. And now, you have people, just on all these different pharmaceuticals. But, so we don't know what the specific health risks are. We don't. But we do know now for sure, that nobody's doing the studies. Nobody's doing the study. Nobody's following how people are doing, taking fluoride or how they're in the baby. We have no idea, and it's like, okay, so what do we do about all this?
Purify your water. And I think that's a big takeaway. I've always tell people it's like, look, anytime we're just giving you guys some facts and stuff like that, just trying to educate you. We don't want this to be fear,
Yeah.
right? Sometimes people, it's the stick and the carrot, the stick being the fear and the carrot being moving towards something beneficial for yourself, right? And so here's the information. I remember in the beginning, I would get scared about this stuff when I finally got educated about it. But I've learned now that when I learn new things, because I'm so used to finding out about all this horrible stuff all the time, I realize that you can't have light without dark. So I'm very thankful for it. And instead of getting stressed out about it itself and causing me to lower my immune system because I'm creating a stress response in my body, no different than getting chased by a saber-toothed tiger, as the example has been pointed out forever, and everybody's used to that for fight or flight mode, and releasing all these chemicals in the body, endorphins and increased cortisol and adrenaline. And if you don't go run that stuff off, then it becomes toxic in the body. So you hear this stuff. We don't want you to get in fear mode. We just want you to look at it and be like, oh, okay. Well, if they're going to do that, then what am I going to do? Right. And not be in fear mode. It's like, okay, well, I'll figure out a way. How am I going to get pure water into my body so I can get away from this thing? How do I purify my water? Right. So the solution is that's where the time needs to be spent. It's like, okay, there's fluoride, they're putting it in there. I mean, hopefully we can, other people can stand up, and if enough working class people just say no. I mean, if the town marched, if everywhere in America a town marched in and said, you're done with this thing, it would be over with like that.
Yep.
It would just be, it's over. It's over. And all this stuff, one thing after another, we're like, okay, we have a list. Okay, no more fluoride. We're not doing this. You have to stop poisoning our food in the grocery stores. Blah, blah, blah. Just go down the list. You're going to stop spraying chemicals and pesticides and fungicides on our food. We're not going to allow it anymore. We're just not going to buy your stuff. That's it. It's over. And
Yeah.
so I think it's really about taking self-responsibility and what you can do. If you stop buying it, it goes away usually, right? Because if the money stops flowing, but in the water system thing, that might be one where some community action, like I know Ashley's going to be taking, and creating a step-by-step procedure so it makes it easy for people to go down and take action so they don't have to figure it all out. They'll have all the body of evidence. They'll be able to walk down, say, here it is, and it's over, right? It's done.
Yeah, absolutely. I think that's perfect. One of the things is it's really easy to filter your water. Go look at the different filters that are out there that can remove fluoride. Your fridge filter, your pitcher filter, probably not going to remove it. So you're going to have to look at the next step, look at maybe reverse osmosis or again, specific filters for fluoride. But you're also absorbing that fluoride through your skin when you take a shower, when you take a bath. A lot of us take detox baths, Epsom salt soaks, etc. So it's not just enough to filter the water. It's about taking that action. And when you take ownership and say, you know what, I can fix this problem. I'm going to fix this problem. In fact, I'm on my way right now. That removes that sense of fear, gives you a sense of responsibility, and empowers you to make change. And I've done a lot of that here in my state. So yeah, I absolutely am going to be working on a step-by-step process for people, but go talk with your neighbors. Let them know that this is happening. Pull up information on this case. I will try to, Jodi will have great links in the show notes, but go have a conversation with your county commissioners, depending on the state that may vary. But these conversations don't have to be difficult. Hey, I really don't appreciate the fact that this is happening to our water. I want to make change. What's the best way to go about this? We need to work with the municipalities and just start having these conversations, because otherwise it's just going to get, like Jodi said at the beginning, swept under the rug. And it's up to us. We have to make change. We're not victims, we're victors, right? And so go out and do the work.
Yeah. Go out and let them know that right? Let them know that you're aware, and maybe they're not aware. Because like we said in the beginning, I mean, there's so much going on in the world, so much chaos, that they're probably not aware. And, and if we just say, remove it, take it out, I don't care about the levels, take it all out. Just take it all out. Same with how we have been calling for the removal of the immunizations, for children. Until you have safety data, right? And you can tell us that these aren't causing all of those comorbidities that I, talked about a few minutes ago, then remove it. Let's take our risk of getting measles and chicken pox. And you're right. Like, what do you guys think about that?
Go ahead, Tim.
I go ahead, Ashley. I was reading something.
Okay. So the fear of measles, it isn't that scary once you realize A, what it is, and B, the most common ways to take care of somebody with measles. Because It's supportive care. It's making sure that they don't have dehydration, that they're not getting secondary infections. So these are very basic things that you can do at home. And we have, in some cases, a very robust medical treatment infrastructure, hospital system. So if you do get a secondary infection, like say pneumonia or a wound infection from a blister, you can go get antibiotics if that's what you choose to do. Some people may choose to go a more natural route and heal those infections another way, but that's again where Tim was talking about personal responsibility. It's taking the fear out of the situation, knowing how to take care of yourself because viruses, bacteria, it's all everywhere. If you're taking care of your body, your risk goes down significantly. And if you know how to take care of your body, guess what? It's not so scary. So
Mhm.
I would absolutely, I mean, we've already taken that risk. I'll take the risk of these illnesses that I have the opportunity to treat if we incur them over the unknown, untold risks. And that's a big S on the end of risk there. The untold risks with these vaccines because we don't know.
Well, let's look at this too. So now we're talking about the measles, right, Jody?
Yeah.
So this has already happened a long time ago. Like we've already been through this, right? So around the turn of the century, there was this thing called the women's labor movement. Okay. And this
Hmm.
was a bunch of very pissed off women that finally had enough. And it seems like when women get mad, things change. And so what happened was if we take a step back, we 1776, we fight the British, we create America. Okay. The Constitution gets created. But it was 18 years after that, there was still a lot of pushback. Those blue bloods from over in Europe and Britain, they didn't like this. Okay. So when they realized that they couldn't do anything to us now because we're clear across the pond, right? And we fought and we won. So they got into business and they started working their way into politics right out of the gate, guys. Okay, right out of the gate. And it was a slow process, but by, the late 1800s, within about 100 years, it was a different form of slavery. And that's what 1776 was about. It was about an oppressive government, once again, the system taking the place of God and not having you a direct connection with God. And basically now you're subject to the system. So late 1800s, new form of slavery in the Industrial Revolution. Women were going to work in these textile companies in these cities. And when you take people and you put them in a very small area and you don't have water and you don't have good sewage and stuff like that, sanitation, what's going to happen? Well, the bugs are going to come in. It's just like if you don't take your garbage out of your kitchen, you just let the garbage pile up, eventually it's going to start stinking and then the bugs come in. In Chicago, when the people put their garbage in the alleyways and the garbage trucks are striking, the garbage builds up, then in comes the rats and the bugs. Then when they come off strike, they clean up the garbage and the rats and the bugs go away. So what was happening with the measles back then? So these women, what ended up happening was is they got so mad because of the slave wages. They weren't making anything. They were working these long 12-hour days, 14-hour days, kind of like nurses, and you guys are still doing it. It's not, it's 5 days, 6 days a week now at least, but long hours, right? And then there was urine and feces in the streets, and there was dead horses and dead cows and goats in the water supply. So people were getting sick. In fact, back at the turn of the century, 14 out of 100,000 people were getting the measles. It was a very high rate, very high rate. So what happened is as the women's labor movement kicked off and they started fighting back and saying, we just want an 8-hour workday. We want 8 hours with our family and we want 8 hours of sleep. That's all they fought for. I mean, 4 people actually got hung at
Yep.
Haymarket Square fighting for an 8-hour workday.
Hmm.
What does that tell you? We're always going to have to fight. Otherwise, you're gonna get your freedoms taken away. So these women, they fight, they fight, they fight, and the movement starts getting traction. Hundreds of thousands of women, eventually millions of people started striking because of this. Over 11,000 strikes from the 1900s to through the 1970s when it kind of just stopped. But what ended up happening was is those women got infrastructure. They got the sanitation workers and the plumbers, right? And they got the dead horses and the dead cows and goats out of the water supply. This took about 40 years. In the mid 40s, because of these efforts of these pissed off women, and the men joined in too, the measles was 98% eradicated, gone, right? They solved it. The measles vaccine hit the scene in 1963. So was it the vaccine that fixed everybody, or was it the cleaning up of the environment? Dr. Bruce Lipton created a new term basically called epigenetics. And it's not, he had this epiphany that he would see, that the genes don't dictate your history, right? But it's what your genes are being bathed in that dictates how they're going to express themselves. I've been arguing this for years. It's like when somebody takes a healthy human cell and bathes it in a known carcinogen so they can study it and watch it how it turns to a cancerous cell so they can try to come up with some type of a chemical that they can patent and make a bunch of money on to stop that from happening. My question is why don't we stop putting the healthy cell in the cancer causing substance in the first place? Wouldn't that make more sense? So isn't that the root of the cause? So this is how you attack the measles and everything else. It's all about boosting the immune system. And how you do that is you breathe clean air, you have clean water, you have really good sleep. Don't misjudge sleep because without it, you're dead in 11 days, the same as water. It's just as powerful. You have to have clean food. You have to move your body. It's designed to move, period, end of story. You have to get sunshine. You have to have good relationships with your friends and your family. That's linked in all the longevity studies. It's the number one thing that came out of the blue zones. The people that live the longest have the most centurions. Number one thing was lifelong friends. And so these are the basic fundamentals that we have to get back to. Being healthy and being a happy, productive society is not really that hard. We've been misled again by this system in between us and our creator. And I think it's really simple. We just got to get back to God, back to nature and Mother Earth. That's where all the solutions are really at.
I couldn't agree with you more, Tim. I couldn't agree with you more. We have to go to break here, but when we come back, I want to talk a little bit more about like what does this ruling say about the relationship between the government, the industry, public health, right? And when we come back, I'm gonna pull up and we're gonna talk about Health and Human Services, the branch of the government that oversees the CDC and the FDA that pretty much told everybody what to do, and people fell in lockstep with it. Bright, bright individuals, sharp individuals fell in lockstep with it. But before we go to break, here, we're going to talk about Green 85. This is Tim, the one who's been talking. This is his formulation with Dr. Treadway. He kept it going. And this is a drink that will help. We talk about the minerals and everything that's been depleted from our soil. Well, this drink I absolutely love. I take a scoop in the morning and a scoop in the afternoon. Since working with Tim, I have really made it a point to try to not have my coffee first thing. And I have my Green 85 and my sauna, and then I walk. And then if I get those things done within 90 minutes, then I can have my coffee. If you guys want to learn more, go to chemicalfreebody.com/out loud and check out the Healthy Detox Gut Bundle that's on that website. And we'll be right back after the break. Welcome back, guys. Thank you for joining me. I am your host, Nurse Jodi O'Malley, and I am joined today by Nurse Ashley Grogg and Tim James, owner of Chemical Free Body. And we're just talking about some things in the news. I want to encourage you guys to download the America Out Loud Talk Radio app because it's 24/7 programming with amazing shows, a couple dozen shows we have on here, and it is streamed 24/7. So anytime throughout the day, you can listen to a different show host talk on a different topic all together. And also, guys, reach out to us, nurses@americaoutloud.com. We love to hear from you. And we have been doing our Friday Q&As. And we brought in a few new nurses, Nurse Nicole, Nurse David, Nurse Ashley, and we are just really energized and just, another move we feel like this movement is making. The nurses have a lot to say, and we are so thankful to have this platform here on America Out Loud to talk to you guys 5 days a week. Our shows play at 10 a.m. Eastern time and an encore at 11 p.m. And all of our shows go to podcast a day or two later. All right, guys. So we have here Health and Human Services. Like I mentioned before, this is our branch of government. It's executive branch of government. The President of the United States pretty much determines who is going to be the next Secretary of the Health and Human Services. And I want to really highlight, I'm trying to get some more light. I did not plan this well, but okay, let's see if that works. Okay. President
Let me
Trump.
read something. Jodi, let me read something. The mission. I just pulled it up. The mission of Health and Human Services is to enhance the health and well-being of all Americans by providing effective health and human services, fostering sound advances in medicine, public health, and social services. So hopefully that gave you time to get your light right.
Yeah, thank you. I
You're welcome.
appreciate that. Yeah, so this is their page, guys. Okay. Oh, I wanted to talk. So I got excited when Trump announced, well, when RFK Jr., because to a lot of us in this medical freedom space, he has been a voice of reason. He has been a voice of science. He has been a voice of evidence for us. And, I remember hearing about his book, The Real Anthony Fauci, and finding out about children'shealthdefense.org and, his work within the environment. And, he's an environmental lawyer. And Trump announced that he was going to have him in his cabinet. So I'm hoping that that would be HHS, because HHS oversees the CDC and the FDA. What do you feel about that, Ashley?
Man, I cannot wait. Like, I pray that that this happens because we do need that voice of reason. When we're looking at this whole system and the way it's set up, it's so broken. Unfortunately, when I was building the heart failure program here at a hospital, we had to answer to a lot of these things, and it's bureaucracy. It's not about health. It all turns into the almighty dollar and how the government is going to, barter over these people. And it's really disgusting. So getting somebody in there who can kind of bring that common sense approach that Tim was talking about earlier, I am thrilled. As a nurse, this should be a breath of fresh air for every single one of us.
Yeah, 100%. So here, I'm going to pop up here. You listening to us on radio, you're not going to be able to see it, but I figured I would share this screen just because I think it's kind of, I just don't even understand. Like, I get more views and I'm censored on social media than our leaders in the health and human services industry. Okay. So let me just pull this up because I want to talk about a couple of topics here. Oh, did I not share sound? Maybe I did not. Hold on one second. I need a producer. We need a producer, don't we? we need some help over here in Nurses Out Loud. We have a lot to say here, y'all. It's all this technical stuff. Okay, hold on. Oh my goodness. I'm going to do it.
While you're looking that up,
Yes,
I
please.
guess for me, I I've done deep dives on lots of stuff. I haven't really studied HHS a lot at all, hardly. But, for me, what I like to do is I like to look at the results.
Hmm.
What's the health of Americans? What's
Yeah.
our health like? And, over 80% of us are overweight, obese, or morbidly obese. Well, that's a problem. 4,300 people a day die of processed food.
Mm.
That's a 9/11 event every day and a half. I talk about that all the time. That would be kind of a big deal. Everybody knows where they were 9/11. It's it's the towers tumbling. It's a scary thing. People's bodies are tumbling down every day, from processed food. There's fluoride in the water. That's allowed. And there's the, they're allowing not just genetically modifying our foods. Then the foods are now being gene edited. Okay. Now there's the vaccines are going into your broccoli, your vegetables. And they're saying this. There's that appeal thing where they put that weird stuff on the outside of vegetables. One thing that's nice is that our local store here, there's no appeal. Everything's organic. So if we look at what's the results, the results are that our children are now going to die younger than us. So I guess I would have to take it and say, if we were gonna if you're a teacher out there and you're listening, what grade would you give them? A B, a C, a D, or an F? How are they doing? And we have to be honest about this, right? So, if I was a teacher, which I am, I like teaching things. I didn't teach people in schools and stuff, but I would probably give them an F. That would be my thing. It's F. So that means that the system is broken. Those people, maybe there's good people in there working, but the system's broken, right? And maybe there's people at the top, they're not really that smart or whatever. And then I look at the politicians and stuff like that, and I'm like, when you look at them, they don't even look healthy to me.
Yeah.
So how can we possibly take advice from people that are not healthy? It doesn't make sense to me. It's like going to a blind ophthalmologist and having them work on your eyes. It really makes no sense.
Yeah.
So, all right,
Well,
go ahead.
speaking of unhealthy, let's put this one up and hear what we have to say about. Let's see. Is it?
Mute it at the bottom.
There's a mute down below.
Oh, see, I can't see it because it's
Right.
Oh, there
It's
we
right
go.
below
Hold on.
your mouse there.
There we go.
With Leah Pryor, executive chef and founder of the Culinary Medicine Program at the University of Vermont Medical Center. Tell us what people should know about your model and maybe how other medical centers could replicate your model to help people.
So when I think about how we can move.
Here we go. You guys can't see this, and I don't even know how that all worked out because I couldn't even hear it. But essentially, we have two unhealthy looking people, okay? And you know what? I will give you my opinion. Let me just read to you a couple of comments, okay? First of all, this caption on here says food
Well,
is essential.
why don't you tell them who it was, Jodi? Who were the people speaking?
Oh, thank you. So it was the Health and Human Services Admiral Rachel Levine, okay, who is a transgender individual, man turned woman, I believe. And she is talking to another man turned woman, maybe person, appearing on TV or on the video, who is speaking in regards to food, who is an obese, unhealthy looking, inflamed individual. And they say in the caption, food is essential to every person's health and well-being. Culinary medicine program pairs nutritional science with preventative health to help people thrive using proper nutrition. Now, just a few comments that we have on here, which is totally true. It says, anybody else see this and think SNL skit? Tell us why we should listen to the advice of obese people. Excuse me, but how many of you need to take several? Oh no, somebody's like, take many. Okay, this is in support of them. Excuse me, but many of you need to take several seats and show some respect as well as educate yourselves. Here's a start. Admiral Levine is a professor of pediatrics and psychiatry at Penn State and previously served as a physician general from 2015 to 2017. So it has some, accolades, if you will, but you have people saying just two dudes being dudes, but not really doing dude activities. Like, I mean, to me, good God, You could provide all that, but if somebody says here, okay, sir, yeah, like I'm going to take the advice of these two clowns. Like this is literally, you go through this page and you see what they're promoting. And here's another thing that really, really, I don't even know, like made me so infuriated. Here we have people that have lost their lives, whole towns destroyed, millions of people over a span of 800 miles destroyed by a hurricane. And our Health and Human Services on their social media takes 5 days to post that they declared a public health emergency. Okay. I did some research and they did put out on the 26th and the 28th of September, I believe, that they were declaring, or 28th and 29th, that they were declaring a public health emergency. But they said that they sent down some assessors to the area to determine if they needed any help. And they didn't need any help. So their efforts were thwarted. Are you kidding me? Are you kidding me? We have people that are still stranded up on those mountains. And it takes that long for our Health and Human Services to even publicly respond on their social media page, whereas they're promoting who still needs the COVID vaccine. Over 150,000 people hospitalized from RSV. Get your vaccine. Celebrating HIV month. And it just, to me, is just, so annoying.
I think the thing that was most frustrating for me watching these videos, because I went through and watched as many of these, and the topic is food is medicine. First of all, they're whitewashing food is medicine. Let's just get that out in the open. They're not talking about truly food as medicine. They are talking again about how the government, how Medicaid, how these hours of health, quote, education can be billed. But I'll guarantee you they're still using the broke food pyramid with a whole bunch of processed junk over good and healthy fats. The pyramid it's abysmal, and it is what's killing people. I looked into this. The people on these little reels or videos or whatever they call them on Instagram, one of them was talking about body positivity. Essentially, that's all it was. Food is medicine. And my sister and I are on opposite ends of every spectrum that there can be. She's a social worker. She's all about body positivity, all the things. And I'm like, look, there is a difference between being comfortable in your skin and being unhealthy and flaunting being unhealthy. You can't do that. That is not body positivity. That is an overcompensation for whatever the heck you got going on in your brain. But what I heard in this one video that just threw me over the edge, it was a woman, I can't remember her name. It was a woman from, I think, the Wisconsin Public Health University. And she sat here and she talked about the takeaway needs to be that bodies come in all different shapes and sizes, and we shouldn't go overboard with this. We need to have enjoyable eating of foods that are generally healthy. As somebody who's obese, bullshit. Okay? Take ownership of what's going on, work towards a solution. That's what we need to do here. But none of these, actually, there was 2 videos that I liked. One of them was of a patient, and his was probably my favorite video because he was a patient on dialysis who talked about how his nutritionist got him hooked up with this program. And it does appear that they have helped him. He says he's feeling a lot healthier. He did also get a transplant, so he's on immunosuppressants. Who knows what his health status was? But the patient talked more about good nutrition and eating vegetables than most of these other things did. And so this tells me that this program is more about being able to bill for, quote, nutritional consulting. They're not really going to change the habits. They're not really going to improve much health overall because they're still stuck on this bunk food pyramid that should go by the wayside. Like, it has no business being in health. Sorry, rant over.
Tim, what do you? Well, I would like to comment
about 10 minutes
on Jodi on that I talk a lot, Ashley, so don't worry about it. You're cool. We love you. So that the Leah Pryor, that person that they were interviewing there, who's the culinary medicine program director, started that at that University of Vermont Medical Center. Um, I just want her to know that, when you dye your hair, it's toxic, okay? Because their hair was pink and yellow in
Yeah,
parts of
and
it.
green.
And so, I mean, I just wanted to say that because once again, it's like it's the lifestyle, it's everything that you're doing, and knowingly or no unknowingly, she doesn't know. I'm trying to tell her because I used to teach classes on that where I teach women. I was like, when you're dyeing your hair, it's killing you. Because I remember reading articles on it like a decade ago, how they actually like shut down the Bay in San Francisco because of and the amount of toxic substances that were causing cancer from hair dyes from people getting their hair dyed. And probably mostly women because I know mostly women get their hair done. And so I point this out, and then nobody really said nothing. Then finally one night, this one woman comes up to me and she's like, just want to let you know something. She's like, don't tell me that I can't dye my hair because I'm going to. I don't care if it gives me cancer. I have to have my hair dyed. Nobody's going to see my roots. You understand? And I was like, she goes, so do not tell me about a problem without a solution. And I was like, whoa. I mean, she was hot. So I went and tried and I started experimenting and I went and got my hair dyed because I had a few grays coming in and I found a thing. This is a long time ago, so I'm sure there's same ones or much better ones, but there was one called Hair Print that brings back your natural color. There was another one called Oway. It's like a farm to chair hair dye, and then there was one called Mastay. So I went through I found three of them, and then so now I had three solutions that I could give people when I brought that up. But the point is like like we were saying, these people do not look like the epitome of health. Okay.
Right.
So it's hard for me I don't take advice from somebody that is not walking the walk. Okay. These people, you have to have first person experience. Like, I guarantee you, I could go take these two people to a track and I could just probably go on a moderately easy jog and I don't even know if they could make it around the track once.
Mm-hmm.
And these are the people in charge of our so-called what's going on with our health. Again, the system completely broken. It's completely broken. We have to put our health as a priority and we have to take back our health ourselves. Mm-hmm. Right? I'm not going to do it for you. Your aunt, Jodi's not going to do it. Ashley, nobody. We have to take responsibility for ourselves. This is how we teach our children what to do.
Yeah.
Monkey see, monkey do. If you want your children to be healthy, then you be healthy. And if you're not healthy, figure it out. There's plenty of places to figure it out. I mean, I know if I can stumble upon this and heal myself and lose 42 pounds and stop my rectal bleeding. I mean, I was life flighted to get an emergency surgery on a vacation. My health was going down the tubes. I was a byproduct of this broken system at age 37. And now at 51, because I realized that nature is the solution, I plugged back into nature with the basic stuff that I talked about earlier: air, water, food, sleep, nutrition, sunshine, all this stuff, lifelong friends, these things. This is how you heal yourself.
100%. Yeah, I agree. And I think we really need to understand that our government is not only there to help us, they have created a culture of order followers. Okay. Anybody that's in a government situation, like the military or, in like my hospital, right? That was a government ran hospital. VA, same thing. These people take orders, and the way they level up in the system is by following those orders. Okay. And the longer they are here, they are in those positions of power, they make money, they have their influence, and they care less and less about the people that they're supposed to serve. I see it all the time. And they're not smarter than the average person at all. At all. They're just order followers.
I think that's one of my biggest frustrations with medicine and when I educate clients or patients or whatever you want to call them, we have to get rid of the take 2 aspirin and call me in the morning mentality. The government isn't responsible for your health. Your doctor isn't responsible for your health. Your auntie, your mommy, your husband, your wife, they're not responsible for your health. You are.
Your
And
neighbor.
Until you start taking that personal accountability and you realize that the power really is in your hands and God did design us to heal, you're not going to get anywhere. And you are making yourself subject to that mentality of I can only do what the doctor says. And we see from the research to their practices to the people leading it, it's all broken.
Yeah.
Yeah, I saw this in many industries. I was a financial advisor. I was in a lot of different industries. Okay. I went from bucking hay bales and digging ditches to, I played baseball. I actually was a construction worker digging even bigger ditches, working big machinery and stuff like that. I served tables as a waiter, opening doors at restaurants, insurance person. When I got into insurance, there was a whole nother language there. And the average client wouldn't understand it. Then I was a financial advisor, another set of languages. And then, I learned stuff about estate planning and stuff like that and CPAs, more languages. Why do you go to a CPA? Because you don't understand the tax code and you're scared of it and you're scared of the IRS. So there's a fear issue there. So the CPA is there to save you. But the reality is that you sign on the dotted line. The CPA is not responsible at all. I go to a financial advisor. We use these words that people don't understand. So they come to you because a language has been created to confuse you so that you hand over your power to the CPA, you hand over your power to the financial advisor, you hand over your power to your doctor because you don't understand it. And that's all these, I think it's all by design, but if it's not, it's just the way it is. And you have to take responsibility back on this stuff. You have to educate yourself enough because if you don't, look at the results. Look around you. How many people in your life are having cancer right now or have had cancer? I know at least a third of the people listening to this message right now, statistically, maybe not this bunch, have cancer.
Yeah.
Right? It's heart disease, cancer, iatrogenics. Maybe you should have an episode on iatrogenics one of these times, ladies, and educate people on that.
Hey, we're down to do it all. I mean, we talk about too diabetes. I mean, Diabetes Association, I think, came out in the 1940s. And look, we have a crisis of diabetics. Our children are diabetic. This didn't happen 20 years ago. We weren't seeing this. So we're doing something wrong, okay? But what we are doing right is if you're listening to us, you are looking for the truth. You are looking for solutions. You are looking for resources that you can share with your community. And guys, very soon here, we have a very important election. And there is a lot on the line and a lot at stake this year. I know a lot of us are awake to this, but I encourage everyone, and I'm closing out my shows these weeks saying, get two people that normally would not vote and go and vote with them. If you can vote early, vote early. Okay. We absolutely need to come out in droves. And unless you don't want to have a civil war and send your wife, your children, your husband off to fight, go and vote. It's so important. I can't say it enough. We have got to get people motivated to get up there and mobilized to vote. Because if they will try to cheat, which won't shock me, because the enemy is controlling all of this. We know this. We're in a battle of good versus evil here. Good versus evil. We have to shine our light so bright that evil will not prevail. Okay. And if you're saying, oh, well, we shouldn't say that the left is evil and the right is good, I'm not saying that. I'm saying that what one side stands for and what the other side stands for, you decide. Until next time, friends, be safe, be well, and God bless.